At this point, I'm going to be reviewing my provider's orders. I'm going to be entering my patient's room, performing hand hygiene, providing patient privacy. Hello, I'm Marielle. I'm your nurse. I'm going to be giving you some Benadryl via your saline lock on your right arm. Do you have any questions at this time? Can you verbalize your name and date of birth? Do you have any allergies? Patient verbalizes name as Foley Ferdinand. I'm looking at his account number, which is 111234, his medical record number, and his date of birth, which is 9/23/1969. Patient verbalizes allergies to penicillin and aspirin. Everything matches from the MAR to his wristbands. There is an additional wristband for allergies, and the patient also was able to verbalize all of those things for me. So I'm going to go ahead and scan my medication over here. Beep. This is my med. Beep. Okay, that's scanned. I already have my vials over here. They are all labeled. The labels may come off because they're not very sticky. But I have all of that prepped. I have my MAR over here. I'm going to go ahead and go over my 5 med rights. So I want to make sure that I have the right medication, dose, route, patient, and time. My patient is Mr. Ferdinand Foley. It is 9/26/2025, and it is currently 9 o'clock. This is when the med is going to be administered. It is going to be, I'm going to administer Benadryl, 25 milligrams via IV, and then it's going to be administered 1 caliber per 12 seconds. Medication, dose, route, patient, time. Like I said, I've scanned my medication. I'm going to go ahead and assess the IV. I'm looking for infiltration and inflammation. None are noted. Mr. Ferdinand, this should only take us about 5 minutes or so. I'm going to go ahead and unlock my J-loop, or unclamp it, if you will. I would take this out of its packaging in a real situation, and we're going to clean for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to allow that to dry. I have my pre-filled normal saline over here. I'm going to go ahead and connect this. I'm going to aspirate. I did get some blood return, so I'm going to go ahead and slowly inject my 3 milliliters of normal saline. Again, I am assessing for infiltration and inflammation and infiltration. None were noted. Take this off. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to allow that to dry. I have my medication. This is my Benadryl, and I'm going to be administering this at 1 caliber per 12 seconds. And I'm going to be administering this over a full full 60 seconds. But for the sake of the video, I just want to verbalize that instead of taking the full 60 seconds. Also, I want to recognize that whenever I have this exposed, after I clean it, I need to put a syringe on it as soon as possible. So I'm just going to go ahead and clean again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Allow to dry. I'm going to put this on here. I'm going to go ahead and inject 1 caliber. I'm looking at my watch here. We're going to give it 12 seconds. 5, 6, 7, 8, 9, 10, 11, 12. Okay, I would go ahead and give the rest the same way. It's caliber, then 12 seconds, caliber, then 12 seconds. So now that I have administered that accordingly, I'm going to be, of course, assessing for infiltration and inflammation, none of which were noted. Take this off. I'm going to go ahead and clean again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I have another normal saline flush pre-filled. I'm going to be injecting my 3 milliliters normal saline at the same rate that I administered my medication. So again, I just want to verbalize, this is the 1 caliber per 12 seconds. I would be doing this for a full 60 seconds. I'm just going to do the first one on camera, and then I'm just verbalizing the rest just for the sake of time. So do 1 caliber. I'm looking at my watch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and I would do the rest of it in the same manner for a full minute. Okay, I'm gonna go ahead and lock my J-loop. We'll take this off. I want to dispose of all my medications in the proper receptacle. So my 3 syringes over here and my med right here. I'm gonna go ahead and take some tape and just properly secure my J-loop. And then again, I would note for any infiltration and inflammation immediately after giving anything through my IV, and none were noted. Like I said, the labeling did fall off, but my medication was labeled. So now that I have administered my medication, I'm going to go ahead and take these off. Perform hand hygiene, provide patient privacy. Just like these would be disposed of properly, these would be placed in the trash can. I'm going to come back over to my MAR. I have administered my medication. Again, it was administered at 9:00 a.m. on 9/26/25. So I would go ahead and put a line through it. I already have my initials and such here. I'm going to go ahead and ensure my patient is in a low lock position, side rails up, call light and reach, perform hand hygiene, and walk out.